Hello everyone, Vanakkam and welcome to Meteor Nursing Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and OET training. And in today's session, we are going to discuss about Jipmer question paper 2022 along with the rationals. Rational in the sense, we are going to discuss all the four options rational so that it will be very useful for you for the upcoming Jipmer as well as PGA exam. So if you like this video, please like it, share it and subscribe it, and don't forget to click on the bell icon. And if you want to follow us, please follow in the Meteor Nursing Academy YouTube channel. So let's begin the session. The first question is alpha fetoprotein test done in pregnancy to detect which condition. There are four options given here: neural tube defect, polyhydramnios, RH incompatibility, birth asphyxia. First, let's understand the question. Alpha fetoprotein test. First, you should know the meaning of alpha fetoprotein. It is nothing but it is a glycoprotein which is produced by the fetus, liver, yolk sac and gastrointestinal system. This is the first point you should remember. Okay, so alpha fetoprotein is over. Next, what is the indication for performing the alpha fetoprotein? The indication is to find out the neural tube defect and Down syndrome. Down syndrome. Okay, fine. So if the alpha fetoprotein level is more, what will happen? If the alpha fetoprotein level is less, what will happen? That is the third point you should know. If the alpha fetoprotein level is more, alpha fetoprotein level is more, then that condition is called as neural tube defect. If less alpha fetoprotein is there, that condition is called as Down syndrome. So in order to find out neural tube defect and Down syndrome, we are doing the alpha fetoprotein test. Fine. Next important point is at which weeks of gestation or at which weeks of pregnancy we are supposed to withdraw the blood. At 16 to 18 weeks of pregnancy, we are supposed to withdraw the blood for performing this test. Okay, so the next golden point is what is the normal level of alpha fetoprotein? The normal level of alpha fetoprotein is 38 to 45 nanogram. 38 to 45 nanogram. Okay, fine. So these are all the points you should remember when you come across the word alpha fetoprotein. Next, till now we discussed about the question. We are understanding the question. Now we have to understand the options and the rationale behind each options. That is very important. Neural tube defect. What is that? There is a problem with the spinal cord and the surrounding structure that is called as what? Neural tube defect. The best example of neural tube defect is spina bifida, meningocele, myelomeningocele. The next one is polyhydramnios. See, the normal amount of fluid has to be in gestation period is, it varies according to the weeks. For example, in 12 weeks, 50 ml, 24 weeks, 500 ml. In case of 36 weeks, it should be about 600 to 1000 ml. 600 to 1000 ml. In 40 weeks, it will be again from the 1000, it will be reducing to 600 ml approximately. So by 12th week 50 ml, 24 week 500 ml, 36 week 600 to 1000 ml. Again it is coming back to 600 in the 40th week. So this is the normal amount of fluid has to be present in the gestation period. But excess amount, that is more than 1000, some books says more than 1500, some books says more than 2000. Okay, whatever it is, more than 1000 ml if you are seeing means that is called as what? Polyhydramnios. In which condition we will be seeing this polyhydramnios? For mother who is having gestational diabetes mellitus. Gestational diabetes mellitus, most common feature is polyhydramnios. Okay, fine. Usually, one more point has to be kept in mind, that is amniotic fluid index. Amniotic fluid index, very important point guys, please listen carefully. Amniotic fluid index means amount of fluid which is present in the gestation period, it is calculated through a index that is called as amniotic fluid index, and the normal value of AFI, that is amniotic fluid index, is 5 to 25 centimeter. 5 to 25 centimeter. If it is less than 5 centimeter, that is oligohydramnios. If it is more than 5 centimeter, that is more than 25 centimeter, that is polyhydramnios. Okay, less than 5 oligohydramnios, more than 25, that is polyhydramnios. This point you have to remember. Okay, so we were discussing about polyhydramnios, and on the other hand oligohydramnios is there. What is oligohydramnios? If the fluid level is less than 5 amniotic fluid index, that is oligohydramnios, or else if the fluid level is less than 200 to 500, that is oligohydramnios. And you all know about the RH incompatibility. RH incompatibility. The best example is RH negative mother and RH positive fetus. RH negative mother and RH positive fetus. Fetus is RH positive, so the fetus blood cell crosses the mother. Immediately the mother will produce antibody against the fetus blood cells. Mother is producing antibody because mother is having negative blood cell and baby is having positive blood cell. So once the baby blood cells are crossing the placental barrier and reaching the mother, means immediately the mother's serum is producing the antibody against the fetus. Understand? So in this situation, the first baby will escape, but the second baby, there is a chance for getting the problem. What problem? Their blood cells are going to get affected. So how to prevent this problem? By means of injecting RH immunoglobulin at 28 weeks of pregnancy. At 28 weeks of pregnancy, and the second injection within 72 hours. Within 72 hours of pregnancy. Understand? So these 2 points is very important in the RH incompatibility, because many times they have asked questions about this isoimmunoglobulin, that is RH immunoglobulin has to be administered at 28 weeks of pregnancy and after delivery of the baby within 72 hours of pregnancy. Okay, and the next one is birth asphyxia, that is the baby is having or not having the capability to breathe. That is called as what? Birth asphyxia. So lack of oxygen supply to all parts of the body, especially to the brain, so the organs are getting deteriorated. That is birth asphyxia. And in this question, the correct answer is, as I mentioned already, alpha fetoprotein test is done in pregnancy to detect two conditions mainly, that is neural tube defect and Down syndrome. Here Down syndrome is not there, so the correct answer is neural tube defect. Neural tube defect. Understand, guys? Fine. Let's move to the next question. Next question is, which probe is used during the first sonography of trauma? You should understand the question. During trauma, which probe we are going to use for ultrasound? Whether it is a linear probe, endocavity probe, cardiac probe, or curvilinear probe. So this is the question. So for this, the right answer is, option D, that is curvilinear probe. Why I selected this option? Let's see the rationale behind this one. Okay, see, there are 4 types of probe. Before discussing about the probe, we should know what is the full form of FAST. But because in the question they asked about FAST, right? The FAST means focused assessment with sonography in trauma. Focused assessment with sonography in trauma. This is the first golden point you should remember. The second point is, there are 4 types of probe which is commonly used during the ultrasound. So let's see the indication of each probe so that we can understand the rationale behind this one. Curvilinear probe. It is used during the gynecological procedure and abdominal organ assessment. That is the first point. And second one is linear probe. It is a high frequency probe which is used to assess the vascular musculoskeletal parts and also the small parts. Because it is a high frequency probe, a small parts visibilities are very clear. The next one is endocavity probe, which is commonly used to check the vaginal, rectal areas, and very useful in early pregnancy. Any kind of assessment, that is perineal region assessment, like vaginal region, rectal region assessment, we can use the endocavity probe. The last one is cardiac probe. From the word itself, it is very easy to understand. It is going to assess the heart shape size. Okay, that is called as echocardiography. Understand? So if you know the indication for each probe, it will be very useful for you guys for solving the answer. So in case of fast sonography during trauma, we are going to use what? Curvilinear probe only. Curvilinear probe only. So the correct answer is option D, curvilinear probe. Identify the ECG given below. They have given a ECG pattern and they are asking us to find out in which disease condition this ECG pattern will be there. These ECG waves are there, whether in atrial flutter, atrial fibrillation, ventricular tachycardia or ventricular fibrillation. So we need to find out in which disease condition this pattern of ECG is present. And here the right answer is option C, ventricular tachycardia. So let's see why I selected this option, ventricular tachycardia, in detail. First, we are going to see about the waves of atrial fibrillation. Before that, you should know the normal ECG pattern, that is P, QRS, T. P, Q, R, S, T. This is the normal ECG pattern. Understand? Fine. If there is any alteration in this pattern, that condition is abnormal ECG waves. Fine. Let's see in detail. First, atrial fibrillation. Atrial fibrillation. In atrial fibrillation, the rate means the heart rate is going to be 300 to 600. 300 to 600. The heart rate. The next one is rhythm. The rhythm is irregular. Rhythm is irregular. What is irregular rhythm? You can see here the RR interval is very short, and here the RR interval is long, and there is no P wave. There is no P wave at all. Okay, so there is an irregular rhythm. There is a irregular rhythm. The normal rhythm means a PQRS, again PQRS, again PQRS. If it is there, means it is a normal rhythm, whereas here the rhythm is totally abnormal. Some areas the rhythm is like this, in some area the rhythm is like this. Okay, so the rate is 300 to 600 beats per minute. The next one, rhythm, it is irregular and there is no P waves. Okay, so the PR interval, we cannot measure the PR interval because there is no P waves at all. Okay, so this kind of pattern is seen in which disease? Atrial fibrillation. Atrial fibrillation. So the next thing is atrial flutter. Very easy to remember the atrial flutter because here you can see a sawtooth pattern. What is sawtooth pattern? You know the saw blade, right? Same like sawtooth blade. This is the sawtooth which is used to cut the wood. Okay, same this type of pattern is you can see here also. Here also. This is called as what? Sawtooth pattern. Okay, so in atrial flutter, immediately you have to think about what? Sawtooth pattern waves. The second point you should remember is the rate. The rate in the atrial flutter is 200 to 350. 200 to 350 beats per minute. The rate is 200 to 350 beats per minute. And next one is rhythm. Rhythm, as I mentioned already, in atrial fibrillation, irregular rhythm is there. Whereas in atrial flutter, the rhythm might be regular or irregular. You can see here the rhythm is regular. And here the rhythm is irregular because there is a big gap between these two waves. Understand? So regular and irregular rhythm both will be present in the atrial flutter. And here also there is no P wave. You cannot see any P wave. Instead of P wave, what wave is present? Flutter waves are present. These are all the waves called as what? Flutter waves. Understand? So this is the main difference between the atrial fibrillation and atrial flutter. Atrial fibrillation, the heart rate is 300 to 600. In atrial flutter, the heart rate is 200 to 300. In atrial fibrillation, the rhythm is totally irregular, whereas in atrial flutter, the rhythm is regular and irregular. And in both the condition, P wave is not there. Both the condition, what is not there? P wave is not at all present. Okay, so these things has to be remembered while discussing the atrial fibrillation and flutter. And next thing is ventricular fibrillation and ventricular tachycardia. So in ventricular fibrillation, you can see very clearly, the QRS complex. The QRS complex is showing the peaks continuously, and there is no P wave. There is no T wave. Only QRS complex is present. Ventricle tachycardia means here the ventricles are going for tachycardia mainly. It's a problem with the ventricles. Okay, so that's why ventricular tachycardia. So continuously peaking of the QRS complex is present in the ventricular tachycardia. This pattern is given in the exam. That's why we selected the option C, ventricular tachycardia. And the next one is ventricular fibrillation. See, in ventricular fibrillation, continuous irregular waves are present. You can see continuous irregular chaotic waves, chaotic rhythm. It is called as what? Chaotic rhythm. Okay, so this kind of pattern is seen in the ventricular fibrillation. So we discussed the rate and rhythm in atrial flutter and atrial fibrillation, right? The same way here also in ventricular tachycardia, ventricular fibrillation also we are going to discuss the rate and rhythm. The rate of ventricular tachycardia will be around 100 to 250 beats per minute. The heart rate is going to be 100 to 250 beats per minute. And the rhythm, what about the rhythm? The rhythm is going to be regular. How I am saying the rhythm is going to be regular? Because you can see continuous similar pattern of waves are present. Similar pattern of waves are present. Whereas here abnormal waves are present. There is no similarity in the waves. This wave is different, this wave is different, this wave is different, whereas here all the waves are similar, right? So we have to consider as rhythm is regular. Rhythm is regular, whereas in atrial fibrillation, irregular rhythm is present. Irregular rhythm is present. And in ventricular tachycardia, no P waves. No P waves. Same like atrial fibrillation and atrial flutter, there are also no P waves. In ventricular tachycardia also there is no P waves. Okay, so these are all the points you have to remember while you are seeing the graph related to ventricular tachycardia. That is, once again I will repeat, the rate is 100 to 250 beats per minute. That is the first point, rate 100 to 250 beats per minute. Second one is rhythm. Rhythm is regular. Rhythm is regular. And P wave, there is no P wave at all. Okay. And the next, ventricular fibrillation. Here the rate is too rapid to measure. Too rapid. Okay. It is more than 300, more than 400, more than 500 it will be there. Understand? It is very rapid to measure. We cannot measure at all. The rhythm is irregular. The rhythm is irregular. Okay, and P wave, whether you can see any P wave here, there is no P wave at all. Okay, so this kind of graph is seen in ventricular fibrillation. That's why I selected the option what? Ventricular tachycardia. That is option C as the right one. The next question what we are going to see is, chronic obstructive pulmonary disease patient is admitted in the intensive care unit. Which method of oxygen is the priority administration? 4 options are given here: face mask, Venturi mask, NRBM and face stent. So you should understand the question here. A chronic obstructive pulmonary disease is there for the patient, okay, and he is admitted in the ICU, and as a nurse, which method of oxygen is the priority to administer to the patient? And here the right answer is option B, that is Venturi mask. Why I selected this option? Let's see the rationale behind this. Okay, see, these are all the types of oxygen therapy which is commonly used in the hospital. That is simple face mask which delivered 40 to 60 percentage of oxygen or 5 to 8 liters of oxygen per minute. Okay, nasal cannula 24 to 44 percentage and 1 to 6 liters of oxygen per minute. Venturi mask, it is the accurate method of administering the oxygen to the patient. Here you can see the detailed explanation. That is, in Venturi mask there are different color codes are there. That is the first point. Okay, so for example, gray means it delivers 24 percentage of oxygen or 2 liters of oxygen. White means 28 percentage of oxygen, 4 liters of oxygen, 31 percentage and 6 liters in orange. See, here everything is accurate in Venturi mask. They have given the amount or percentage of oxygen going to be delivered to the patient as well as the liters of oxygen going to be delivered to the patient. If you are taking red color, 40 percentage and 10 liters of oxygen is going to be delivered. So directly we can say this much amount of oxygen is required to the patient. So I am using this color code Venturi mask. So it is an accurate measurement for administering the oxygen. That's why we selected this option. Okay, other things like partial rebreathable mask. Okay, here 40 to 70 percentage of oxygen and 6 to 10 liters of oxygen can be delivered to the patient. And non-rebreathable mask, 100 percentage of oxygen can be delivered to the patient here in non-rebreathable mask. That is 60 to 100 percentage. Okay, this is also a very commonly asked question in the exams. Okay, 100 percentage of oxygen can be delivered to which type of mask? So the correct answer is non-rebreathable mask. Okay, fine. So these are all the things you have to remember while solving this question. The next question is total dose of FIPV. They have given 4 options, 1, 2, 4, 5. First you should remember the question. What they are asking? They are asking total dose of FIPV. Okay, how many dose we have to give to the kids? What is FIPV? Without knowing this, you cannot solve this question at all. FIPV means fractionated, okay, injected polio vaccine. This is the full form of FIPV. Okay, so fractionated injected polio vaccine. So what is this? It is a injected polio vaccine. You all know about the oral polio vaccine, and FIPV is a injected polio vaccine. That is the difference between these two things. This oral polio vaccine we will be giving at the birth. This injected polio vaccine, when we will give, how many doses we will give, that is the question. That is the question. Okay, so here the right answer is option B. Option B. Why I selected option B? Let's see the rationale behind that. Okay, so the rationale behind that is this fractionated injected polio vaccine will be given during 6th week and 14th week for the babies. So how many dosage we are giving? First and second dosage. So 2 dosage we are giving. That's why I selected option B. One more doubt you will be getting. If we are giving oral polio vaccine, whether it is compulsory to give FIPV? See, FIPV is a additional dose. Additional dose. If you want, you can give. Otherwise, it is not required. It is an additional dose. Understand, guys? So, on the whole, total dose of FIPV is 2 doses we are giving to the kids or babies when we are going to give in the 6th week and 14th weeks after the delivery of the baby. Okay. Rest of the questions we will be discussing in part 2. Till now we discussed part 1 with adequate explanation on each and every options. So the rest of the questions we will be discussing in the part 2. This is how you have to understand the question and options, guys. without understanding the question, what they are asking, which is the keywords in the question, and without understanding the rationale behind each and every option, you cannot solve the questions. So understand the concept, rationale, keywords, and solve the questions. In order to understand all those things, please keep on watching our videos. We will be giving adequate explanation about each and every points which is essential in each and every questions. So soon we will be posting part 2 within 2 days. So please follow us in Meteor Nursing Academy YouTube channel. Thank you, and share this content as much as possible to reach everyone. Thank you once again, guys.